If you're over 60, there is a simple shower habit that might quietly raise your risk of stroke, and it can happen overnight with no warning, no pain, and no symptoms at all. You might step into the bathroom feeling fine, ready to rinse away the day, but by morning, your speech could be slurred, your balance gone, or one side of your body refusing to move. Yes, something as ordinary as your daily shower, something that feels relaxing, comforting, even healthy, can quietly trigger a chain reaction inside your brain and blood vessels. Today, I'm going to walk you through 5 common shower habits that may seem harmless, but can quietly increase your risk of stroke, memory loss, or even brain bleeds, especially if you're over 60. Now, let's start with the first dangerous habit. Dangerous shower habit number 1. Taking very hot showers at night. There's something incredibly soothing about stepping into a steaming shower before bed. It eases muscle aches, relaxes stiff joints, and feels like the perfect way to wind down after a long day. But here's what most older adults don't realize. That comforting warmth can quietly become a silent threat to your brain. When hot water hits your skin, your blood vessels dilate, meaning they expand, like rubber bands being stretched to their limits. This sudden expansion causes your blood pressure to drop, sometimes sharply. For younger people, their arteries are flexible enough to handle these sudden shifts. But once you reach your 60s and beyond, your vessels lose elasticity. Your heart and brain rely on stable pressure to function properly. A sharp drop in blood pressure at night can leave your brain undersupplied with oxygen. It's not just about feeling dizzy or lightheaded, though that can happen, too. It's about circulation slowing down enough for clots to form. And once a clot reaches the brain, the result can be a life-changing stroke. I'll never forget one of my patients, Mr. Reynolds, a 74-year-old retired mail carrier. Every night at 10 p.m., he'd take a long steaming shower before bed. He loved how it made him feel calm and ready to sleep. But one night, shortly after finishing his shower, he mentioned to his wife that he felt unusually weak. He brushed it off and went to bed. By morning, he couldn't move the right side of his body. His words came out slurred, and confusion clouded his eyes. At the hospital, scans confirmed an ischemic stroke. The drop in blood pressure during his shower slowed circulation enough for a clot to form and lodge in a critical artery overnight. What seemed like a soothing routine had quietly set the stage for tragedy. This is what I tell all my patients. Your body at 70 doesn't respond like it did at 30. The same hot water that relaxes your muscles can also rob your brain of stability. The risk grows even higher if you're on blood pressure medications. Those drugs are already lowering your pressure. Add a hot shower to the mix, and the drop can become dangerous. So tonight, before you step into a steaming shower, remember, what feels comforting can quietly be starving your brain of oxygen. But hot water isn't the only hidden danger. The next one has to do with timing, and it is something I see seniors do all the time without realizing the risk. Dangerous shower habit number 2. Showering immediately after a big meal or medications. For many older adults, it feels natural to finish dinner or take evening medications, then head straight to the shower. It's part of a comforting nightly routine. But here's the problem. Eating a large meal diverts blood to your stomach to help with digestion. If you shower immediately afterward, the heat from the water pulls even more blood toward your skin. Suddenly, your brain is left with less than it needs. This double diversion, digestion plus heat, can create a dangerous drop in brain circulation. The result? Clots can form silently. There's no warning, no pain, no symptoms until it's too late. I once treated a patient named Mrs. Thompson, a 76-year-old retired teacher. Her nightly routine: take blood pressure medication after dinner, then head to the shower to relax. One evening, after finishing her shower, she began to feel dizzy. Moments later, her vision blurred, and she collapsed onto the bathroom floor. When her daughter found her, she was struggling to speak, her right arm limp. At the hospital, scans confirmed a stroke. The combination of medication, digestion, and hot water had pulled too much blood away from her brain, causing circulation to slow and a clot to form. Here's what I tell my older patients. Your brain cannot handle sudden circulation changes anymore. At 60, 70, or 80, your heart pumps more slowly. Your arteries are stiffer. Medications already alter your pressure. So please, wait at least an hour after meals or medication before showering. Give your body time to stabilize, to balance itself again. Now, if you think timing is the only issue, Wait until you hear about the danger of staying in a hot, steamy shower for too long. This one catches even the most careful seniors by surprise. Dangerous shower habit number 3. Standing too long in a hot shower without ventilation. Many older adults enjoy a long, steamy shower in a closed bathroom. It feels like therapy, easing pain, loosening stiff joints, helping you feel younger. But here's the truth. A small, steamy bathroom robs your brain of oxygen while lowering your blood pressure. The combination can slow circulation, thicken your blood, and set the stage for a clot to form. I once had a patient, Mr. Wallace, a 79-year-old retired mechanic, who loved his nightly routine, a 20-minute hot shower in a sealed bathroom. One evening, after his usual routine, he stepped out feeling dizzy. Minutes later, he collapsed. By the time he was found, his speech was slurred, and his right side was paralyzed. The stroke was severe, caused by oxygen deprivation and slowed circulation from prolonged exposure to steam and heat. If you enjoy showers, keep them short. Always ventilate your bathroom, and never stay under steaming water longer than necessary. And if you think this is surprising, wait until you hear about the danger of cold showers first thing in the morning. Dangerous shower habit number 4. Sudden cold showers first thing in the morning. Cold showers have become a popular trend. You see them promoted everywhere. Fitness influencers, health magazines, and TV doctors praising their benefits for boosting energy and circulation. But here's the reality. What might be invigorating for a 25-year-old can be extremely dangerous for someone over 60. Why? Because when icy water hits your skin, your blood vessels constrict instantly. This is your body's natural response to cold, designed to conserve heat. But that sudden constriction causes your blood pressure to surge upward, fast. For younger people with flexible arteries, this spike is manageable. But for older adults, with stiffened vessels and a heart that doesn't pump as strongly, this sudden rise in pressure can damage fragile arteries. Tiny tears form along the vessel walls. Your body reacts by forming clots to seal those tears. But if a clot breaks loose and travels to your brain, a stroke can occur within minutes. One patient who learned this the hard way was Mr. Jennings, a 68-year-old retired firefighter. He had always prided himself on being tough and disciplined. After watching a health program, he started taking ice-cold showers each morning to shock his body awake. At first, he said it made him feel energized, but on the 7th morning of this new habit, only minutes after leaving the bathroom, his wife found him collapsed on the bedroom floor. His face drooped on one side, his words were garbled, his right arm lay limp. In the hospital, scans confirmed a stroke. The intense cold had caused his blood pressure to spike, leading to a clot that cut off circulation to his brain. This is the danger of following routines meant for younger bodies. At 60 or 70, your vessels can't handle the same level of shock or stress. What invigorates a younger person can rupture an artery in an older one. So, if you enjoy cooler showers, start with lukewarm water. Gradually lower the temperature over time. Avoid sudden, extreme cold. Your brain and heart depend on it. Dangerous shower habit number 5. Showering late at night before bed. For many older adults, the nighttime shower is a ritual of peace. The house is quiet, the day is done. A warm shower feels like the perfect way to relax before sleep. But what most people don't realize is that showering late at night can create the perfect conditions for a stroke, silently while you sleep. Here's what happens. At night, your body naturally lowers its core temperature to prepare for rest. When you step into a warm shower, your body temperature rises instead, throwing off your natural rhythm. The heat causes your blood vessels to expand, pulling blood toward your skin and away from your core circulation. On top of that, showers promote fluid loss through sweat and evaporation, leaving you slightly dehydrated. For a younger person, this isn't a big deal. But for someone over 60, especially if you're on medications that already lower blood pressure or remove fluids, this combination can be dangerous. Dehydration thickens the blood. Lower blood pressure slows circulation. Together, they create the perfect storm for clot formation. Often while you're asleep and unaware. By morning, the damage is done. One patient I'll never forget was Mrs. Carter, a 79-year-old grandmother who lived independently and stayed active. Every night, around 11 p.m., she'd take a long hot shower before bed, a ritual she believed helped her sleep better. But one morning her daughter called and noticed her mother's words sounded slurred. Alarmed, She rushed over and found Mrs. Carter confused and unable to move her right hand. At the hospital, imaging confirmed a stroke. Overnight, her blood pressure had dipped too low, and her blood had thickened from dehydration. The warm shower had quietly set the stage for tragedy. This is why I urge seniors to avoid late-night showers. Take them earlier in the evening instead, at least 2 hours before bed. Drink water afterward to replace lost fluids and stabilize circulation. Your brain is especially vulnerable at night. Protect it by giving your body time to cool, rehydrate, and recover before you sleep. Building a safe, brain-friendly shower routine. Now that we've covered the 5 dangerous shower habits, it is time to talk about what you should do. How to create a shower routine that protects your brain, supports your heart, and keeps you strong as you age. The truth is, showers are not the enemy. They can be relaxing, refreshing, and even beneficial, if done correctly. What matters most is understanding your body's limits and adjusting your habits accordingly. Let's walk through the key steps to making your shower a safe, health-supporting ritual. 1. Choose the right temperature for older adults. The safest shower temperature is warm, not hot, not icy cold. Aim for water that feels comfortable on your skin, but doesn't cause sudden changes in circulation. If you enjoy cooler showers, ease into it gradually. Start warm, then slowly lower the temperature toward the end. This gives your vessels time to adjust without triggering a sudden pressure spike. Pro tip: use your wrist, not your hand, to test water temperature. The skin on your wrist is more sensitive to heat and cold, giving you a better sense of what's truly safe. 2. Shower at the right time. Timing is critical. Avoid showering immediately after meals. Wait at least 1 hour. Don't shower right after taking medications, especially blood pressure meds, diuretics, or heart pills. Skip late-night showers. Aim for earlier in the evening, giving your body time to cool and stabilize before bed. Your brain needs consistent blood flow to stay healthy. By timing your shower properly, you reduce the chance of sudden pressure drops or clot formation. 3. Limit shower duration. Long, steamy showers may feel luxurious, but they can quietly rob your brain of oxygen. 5 to 10 minutes is ideal for most older adults. Any longer, and you risk lowering oxygen levels in a small, enclosed bathroom, especially without ventilation. Pro tip: set a small timer in the bathroom. It has an easy way to make sure you're not losing track of time under the water. 4. Keep the bathroom ventilated. Always open a window or run an exhaust fan while showering. Proper ventilation prevents steam buildup, which keeps oxygen levels stable and reduces the risk of dizziness, lightheadedness, and circulation problems. If you live in a home without windows in the bathroom, consider installing a small fan or leaving the door slightly open to let fresh air circulate. 5. Hydrate before and after. Many older adults underestimate how much fluid they lose during a shower. The heat causes light sweating, and evaporation pulls additional moisture from the body. Drink a small glass of water before and after your shower. This helps keep your blood thin, your circulation strong, and your brain properly supplied with oxygen. 6. Listen to your body. Dizziness, sudden weakness, blurred vision, or even a fleeting sense of imbalance after a shower is not normal aging. It's a warning sign. If you notice these symptoms, don't brush them off. Sit down immediately, hydrate, and if they persist, seek medical attention. Early detection can prevent a major event. Stay safe, stay healthy, and remember, protecting your brain starts with the simple choices you make today.